Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
My name is Sheila Krishnaswamy, wishing all the doctors a very happy Doctors' Day. Internet is a great place to gain knowledge, and social media platforms have helped to connect not only family and friends but also professionals across the world. Unfortunately, social media platforms have also thrown up a lot of misinformation, especially when it comes to health. Just to give you a little statistics, a latest study that analyzed 9,657 pieces of COVID 19 misinformation from 138 countries, India notoriously ranked number one for generating the maximum number of misinformation at 18.07%. And some of this information was health related, which can unfortunately misinform those who are looking to make health decisions. So, in this edition of Health Files relating to Doctors' Day, which falls on July 1st, we asked some well known practicing doctors how misinformation can affect the treatment process, and if it does, how they tackle such problems. So, the first question we asked was, how does medical misinformation act as a problem in the overall treatment procedure? So let's see what the doctors have to say.
Health misinformation is what? That is any news or any health claim that you have read or heard in the media, which is with little evidence or an anecdotal evidence, which does not have a foolproof evidence scientifically. That is health misinformation. There may be two types of this misinformation, where something is not really true and is false. It's a hearsay and which may not harm the patient, but the patient or the person with that particular disease is taking it. And the second type is intentionally trying to give something which is not having a cure or a claim at all, but still claiming that this is best, which may harm the people. So I think the most important thing is which are those diseases which are usually there in this kind of a jargon of misinformation. They are usually, one is drugs, smoking. We have issues about non-communicable diseases like obesity, diabetes, blood pressure, cholesterol, cancer. All the time there is some misinformation going around. Healthcare, the diet thing is also absolutely, if anybody talks anything about diet without a proper background, baseline knowledge, we need to have proper qualification or qualified people to those who can speak. As you rightly asked, that some people just start talking about it. Yes, that's very important. We've had some patients, after doing 3-4 appointments, they think that so much that they start blogging and try to attract a lot of crowd. And let me tell you through your media that every patient may not be the same all the time. The information given to them, the treatment given to them, the lifestyle changes given to them may differ in a lot of ways. So in short, if I have to summarize, there is a lot of myths about vaccine and smoking, a lot of myths about miraculous diets, a lot of myths about some misleading advertisements, and which may not be based on actual scientific proof, but some small anecdotal, small proofs here and there. So we got to be very careful what we are consuming.
At least 20-30% of patients coming to us with lots of preconceived notions or myths and fads that have been fed from probably neighbors, family, friends, colleagues, most of them not doctors, and they come with a kind of a preoccupied thoughts, and then they are resistant or refractory for explanation of treatment. So most of the times, it is really hard to explain the disease to them, or the whys and hows and how to treat, and all these when we try to explain. When they are refractory to understanding our explanation, it really becomes hard to further go forward in treating them.
Today is the era of information which is available at your fingertips. हमें क्या करना है? फोन उठाना है, गूगल घुमाना है, और खूब सारी इंफॉर्मेशन हमारे सामने प्रेजेंट हो जाती है. But is all information correct? Or some information is misinformation? That is what message we want to convey to you today. आज के समय पे यदि आप एक पर्टिकुलर डिजीज या यदि एक सिम्टम को आप पुश करते हैं, गूगल में ढूंढते हैं, तो आपके सामने हजारों ऐसे पेजेस खुल जाते हैं या हजारों ऐसे फैक्ट्स आ जाते हैं जिसमें अधिकतर अनवेरिफाइड होते हैं। फॉर एग्जाम्पल, अगर किसी पर्सन को जॉन्डिस है और वो जॉन्डिस डाल करके खोलता है, तो छोटी से छोटी जॉन्डिस जो गंदे खाने गंदे पानी से बड़े कैंसर तक उसको किसी भी प्रकार की इंफॉर्मेशन मिल जाती है। साथ ही साथ उसमें मेडिकल इंफॉर्मेशन तो होती ही है, उसके अलावा लोगों के पर्सनल एक्सपीरियंसेस होते हैं। सिंस हम पर्सनल एक्सपीरियंसेस के साथ ज्यादा अपने आप को रिलेट करते हैं, इस वजह से ऐसा लगता है कि वो ज्यादा फैक्ट्स हैं, तो उस वजह से बहुत बार ट्रीटमेंट डिले हो जाता है। कहा जाएगा भाई जॉन्डिस का तो इलाज ही नहीं है। जॉन्डिस का इलाज न सोच के कोई इंसान यदि हॉस्पिटल नहीं आता है तो अपने आप को ज्यादा बीमार कर लेता है। बीमारी समय रहते यदि हम ठीक कर सकते हैं तो वो ज्यादा अच्छा होता है, बिकॉज हम ये जानते हैं कि सही समय पे अगर हमने अप्रोच किया तो डॉक्टर ना केवल हमारा थेरेपी बेटर कर सकते हैं बट जल्दी रिकवरी की उम्मीद भी जगा सकते हैं। ऑल्सो इट इज वेरी इंपॉर्टेंट कि जब कभी भी हम कोई ट्रीटमेंट शुरू करते हैं, जैसे किसी दवाई को दे रहे हैं, तो इस दवाई के साथ में ऐसा महसूस होता है कि लोग पहले खुल कर पढ़ते हैं, अच्छा इसका ये इफेक्ट है, लेकिन उससे पहले वो जानना चाहते हैं कि इसके साइड इफेक्ट क्या हैं। और साइड इफेक्ट्स के बारे में एवरीबडी नीड्स टू अंडरस्टैंड कि इवन द रेयरेस्ट ऑफ द साइड इफेक्ट्स हैव टू बी रिपोर्टेड। से फॉर एग्जांपल एबीसी दवाई के साथ में यदि हेयर फॉल का साइड इफेक्ट लिखा हुआ है, हो सकता है वो हजारों में किसी एक इंसान को, लेकिन उसको हम सही मान लेते हैं और हमें लगता है कि अरे हेयर फॉल हुआ, ये तो पक्का इसी दवाई की वजह से हुआ होगा, एंड इस वजह से ट्रीटमेंट की इंटरप्शन हो जाती है। सो इस तरह का इंफॉर्मेशन और मिस इन्फॉर्मेशन, इस चीज का डिफरेंशिएशन हमें रखना है।
Medical misinformation has become a hindrance to the treatment of patients these days, as patients and their family members gather information from random internet search that interferes with the scientific treatment protocol that we as doctors follow. And all this ends up spoiling the doctor-patient relationship that is primarily based on trust.
It's good to be informed. It's good to be an active part in the treatment process. However, my suggestion will be, first meet the doctor, let them make a differential diagnosis, let them confirm the diagnosis, and then probably will be the right time to Google up that particular diagnosis, so that you know, okay, how the natural history is going to be, what are the treatment options, what if one treatment is not working for you, what are the other options that you have, and what is the expected result of the treatment.
There are many sources of misinformation: WhatsApp forwards, relatives, uninformed individuals, all these misinform. And of course, there are certain unqualified people who tend to misinform the person. Misinformation can really affect the medical treatment in a large way. Most of the misinformation or misconception, I would say, comes from dietary advices. There are a lot of dietary advices such as not to take sugar, or not to take artificial sweetener, or to eat certain amount of food or certain amount of diet, or not to have milk, or so and so forth. All these things are misinformations which can affect patient treatment and their tolerability of treatment. So I think it really affects also that certain type of chemotherapy should be done. There should be definite hair fall. If hair fall is not happening, then your treatment is not effective. Well, there can be nth number of misinformation. The list is so long that I cannot really complete it. So it really affects, and they should be aware that this misinformation can be very dangerous for their treatment.
With the time, I've seen that the medical information or misinformation is everywhere. Means through the WhatsApp, through the Google, or even through, I should say, Facebook or Instagram. So from everywhere there is information, and it is very difficult for us to discriminate which one is authentic and which one is not. About the normal patients or the everyone, I should say, is getting the information and they are not sure whether it is right or not. They start believing that whatever they are getting is right, and they start claiming to when they come to us, they ask us, I have heard this and this, and I think it's true, and you are not going, you should change your treatment protocol according to my information that they used to say so.
The second question we pose to them is, how can a patient improve his knowledge about the treatment procedure? And here's what the doctors said.
So I strongly recommend that if you're trying to get information from the net, for example, there's so much. In fact, 90% of the information on the net is not really evidence-based medicine. So I would encourage that you get information from colleagues or friends who have some kind of a medical background, and even if you are you have that information. I would really encourage that you listen to what your doctor is saying, because most of the time, if you have preconceived notions, then it will be hard for you to understand and accept. And with that, there is a mistrust that is developed between patient's family and the doctor, and then that the nexus is not really holy, and it really can't go forward in a healthy manner.
Please remember, information does not translate into knowledge. नॉलेज के दो ही सोर्स होते हैं, एक जो आपके कंसल्टिंग डॉक्टर्स हैं जिसको आप अपनी बीमारी का इलाज करा रहे हैं, दो कोई ऐसा सोर्स जो कि आपको करेक्ट इंफॉर्मेशन देता है। फॉर एग्जांपल, यदि वीट एलर्जी की बात करी जाए तो हमारी सीलिएक डिजीज सोसाइटी ऑफ इंडिया है जिसकी अपनी वेबसाइट है जिससे आपको अप्रोप्रिएट और करेक्ट इंफॉर्मेशन मिलेगी। यदि आपको लिवर के बारे में जानना है तो लिवर की नेशनल एसोसिएशन फॉर स्टडी ऑफ लिवर की वेबसाइट है, उस पर डॉक्टर्स और पेशेंट्स दोनों के लिए करेक्ट इंफॉर्मेशन है। उसके अलावा भी WHO एक बहुत ही अच्छा सोर्स होता है जिसके साथ में आपको अप्रोप्रिएट हेल्थ रिलेटेड कंडीशंस, हेल्थ रिलेटेड आंसर्स, बीमारी से रिलेटेड सारे सवाल, खान पान से रिलेटेड सारे सवाल सारे पता चल सकते हैं। तो ये चीज़ों की नेसेसिटी यदि आपको पड़े तो कृपया एक वेरीफाइड साइट पे जाएं। हम अपने पेशेंट्स को हमेशा कहते हैं, हेल्थ इज होलिस्टिक इन नेचर. It is physical, it is mental, it is social. So all these components need to be addressed whenever we are giving an answer about being in good health. बीमारी के समय पे करेक्ट इंफॉर्मेशन लेना, डॉक्टर से करेक्ट कंसल्टेशन लेना, किसी ऐसे पर्सन से डिस्कस करना जिसको इस बीमारी का नॉलेज हो, या फिर किसी ऐसी सोर्स से पता करना जो कि करेक्ट आंसर दे सके, मरीज को हमेशा फायदा करता है.
I think it's very easy to go to a website which is authentic, either from a government line for that particular disease, or go to a particular hospital which deals only with that particular disease, or let it come through the particular doctor who's a super specialist in that particular disease. If a patient or a person goes to in general on any website, then you get lost into the whole jargon. For example, if you Google headache, it will reply back that you got head cancer. If you Google body ache, you will get that reply that you got some kind of a big problem in that area, which may not be the thing. It may be a simple vitamin deficiency. So I think these 3 or 4 important things, if we do, it will solve a lot of things.
There are a lot of websites. Of course, these websites and this websites, mostly they have been developed and they are quite improvised and they are quite up-to-date websites from America, but these are free. For example, www.cancer.gov is a website which is of American Cancer Society or National Cancer Institute. It gives you valid information about most of the questions or misconceptions that patient has in a very simple terms, and they're all free information, and it is authenticated because it is coming from America. We all know that most of our celebrities and who's who, they go to America for treatment, and American Cancer Society is perhaps by far the most developed and the most researched society where most of the research comes from. We have recently heard about dostarlimab. That was a research coming from America only, which made news everywhere. So this is quite authenticated. Now people cannot say that, okay, I am likely to believe dostarlimab results and I would like to seek those results and seek that medicine for my patient, but I would not like to believe the American Cancer Society dietary advice which says to eat sugar, to eat milk. So you cannot be selective in the information. If you believe it, then you've got to believe it whole. So I think there are authenticated websites which will not question. This will provide good information. Then they can ask their doctors that where should I read more about my illness. So these websites will label all the diseases according to alphabetical order, and they will explain everything. And so say for example breast cancer, you can go to B, select breast cancer, and then go to whether you are a professional or whether you are a patient, then read about that information. So very up-to-date knowledge can be given. So there are websites, there are guidelines which a patient can also read and understand in simple terms. In case there is none, then they can still read the medical literature. Of course, it will not make much head and toe of it, but I think they can always ask questions. They can go through it. If not 100%, it will make 10% sense. Read it again, it will make 20% sense. And then they can go back to their health professional and ask specific questions that I did not understand this, I did not understand that. What sense does it make to me? And a good healthcare professional will definitely help you understand the medical literature, so as some information relevant, authentic, some information is still better than misinformation. So rather than getting misinformed, be informed, even if it is partial information. That good, authentic, realistic information is still better than any sort of misinformation.
Patients can improve their knowledge about the treatment procedure by getting in touch with the treating doctor, asking them about the line of management and treatment protocol, taking second medical opinion from professionals of the same field, and gathering information from credible, validated sources, including research articles and books.
Lastly, we ask the doctors to share some advice that they would give to their patients about staying healthy and about escaping misinformation. And this is what they said.
Staying healthy, a healthy diet, a good sleep, and little bit of exercise.
You should always walk at least 45 minutes continuously in a day. Maintain a good posture. Do gentle exercises for the back and knee for around 10 to 15 minutes in a day. Use good quality sports shoes. Have a good and sound sleep at night. 6 to 8 hours is good. Use a good quality mattress. Eat healthy and a balanced diet as per your body weight. Maintain a good BMI of around 20 to 22. Stay healthy, stay active.
Apart from correct information, what you need to take is a good, healthy and nutritious diet. Walk for 30 to 40 minutes every day. Spend some time in relaxation with yourself. Do some meditation, pranayam or yoga every day. यदि आप ये सब भी नहीं कर सकते हैं तो simplest of the thing is to do 30 to 40 minutes of brisk walking. इन सब चीजों से आप अपनी हेल्थ को अच्छा रख सकते हैं. हेल्दी और संतुलित आहार खाएं, स्मोकिंग और अल्कोहल से बचें, अपने शरीर के वजन को कंट्रोल में रखें. यदि आपको बीपी, शुगर, हार्ट जैसी समस्या है तो अप्रोप्रिएट दवाई खाएं, अपने शुगर को कंट्रोल में रखें, अपने बीपी को कंट्रोल में रखें और अपनी सेहत को अच्छा बनाएं.
I always advise my patients to follow a proper sleep schedule, a proper meal schedule, avoid eating junk food, decrease your screen time, and please do not Google your symptoms.
There are a lot of good advices that I give, and I think every oncologist should give. And there are a lot of articles on it also. What to eat, how to eat, during treatment, after treatment, and how to do exercises. What does American Cancer Society says? How much exercise is good for me? How much is not good for me? All these things are very important. For example, American Cancer Society says that 30 minutes of strenuous exercise 5 days in a week is good. Now people don't understand what is strenuous. Strenuous is running. If you can't run, then jog. That is moderate exercise for 1 hour, but then the duration increases. If you can't jog also, then you can walk. But then walking, that is light exercise. That is about 2 hours. People say, I do yoga for 15 minutes. That's not enough. Yoga is light exercise. You got to do it for 2 hours to be equivalent to 30 minutes of strenuous exercise. So these are advices. Advice during treatment, dietary advice during treatment is different from dietary advice after treatment. After treatment, you got to reduce weight, shed those extra kilos. Then you have to be selective in what you are eating. But during treatment, when you are undergoing chemotherapy, you eat more. You eat more healthy, rich diet. Even if you gain weight a bit, it's fine. So these are various advices. Then of course, we tell them about where to gain more information about the disease. What are other alternative modalities of treatment which can be beneficial. So lot of things education, patient education about disease, expected outcomes, what to expect from the chemotherapy, what are the side effects, how do you circumvent those side effects, how do you treat those side effects, how do you prevent the side effects of therapy, what are preventable, what are non-preventable side effects. So nth number of advices are there, and all this information is very important and vital. Not only this, understanding of the disease biology, different subtypes of disease, and not to compare your own case with other cases. The other case, even if they suffer from the same disease, can be so very different, and you should not compare your case with other cases or your treatment with other treatments. Your treatment is designed, tailor made, and is not only designed, it's meant for you, because you are an individual. Cancer may be same, but cancer has subtypes. It responds differently in different individuals to the same therapy also. So never compare your case with others. Don't go on hearsay. Ask questions, there is no problem. Ask as many questions, but believing anything on face value is not good. There's always an authentic side of it, and it is available. In the era of Google, where you can Google everything, we can help you know which are the websites which give you authentic information. These are not our personal websites. These are standardized websites from the world. I cannot even modify those websites. So these are the sites. So don't go by hearsay. Use your brain, use your cool. Don't lose your cool, don't panic. And this is what we tell them. Take an informed decision, a well-informed decision.
Eat well, sleep well, at least 7 hours a day, go for walking, maybe at least 60 minutes a day, drink water adequately, and keep your relationships healthy, whether it is at home or outside home. Your part 2 of the question, what they should do for the right information. First is, if you have received an information in whichever media channel, in whichever social media, if you're not sure about the source's authenticity, do not share. So no sure, no sharing. Number 2, talk to your doctor. Whatever the doctor has told you, especially if your doctor is a super specialist, that small thing that your super specialist has said may be very important in terms of your management and your treatment. And the last one that I want to tell is that hear from whatever you have heard, but implement it only after you've discussed with your doctor in your appointment. Till then, hold on your guards, wait for the right source of person to confirm that particular information, and then use it for your life, for your disease, for your problem. Thank you.